We will go directly to the question and answer period. I will ask everybody to limit their answers because we have about 20 minutes. I will go to the questions as they were presented. The first question was to Dr. Wang, Kui Chang from Beijing. A question from Mr. Richard C. here in Stockholm. His question was, I don't know if you can answer that, is what is China doing to prevent a second wave of outbreak of corona after they controlled the first wave?
Yes. Okay.
Yeah.
Can you hear me?
Yes, we hear you. You lower just the camera so we can see you better.
Okay.
Please be brief.
Okay. Okay, this question is how to prevent the second wave for China, right? So now in China, we have the strategy to prevent the import case and prevent the second wave in China. So the first thing we have to do to control the import case. So we detect all the import passengers in our border to make sure they have not infected. Even some of asymptomatic cases we happened from the Russia-China border and other, and the Guangzhou, the city. So this is the first thing we can do to detect all the passengers coming China. And the second, we just to control the second spreading from the imported case. This is the second part we have to do. The third part, we have to prevent the cluster case in a hospital, in the school, or in some office. So although we start to recover the working and the schooling, but we still keep the high levels, the prevention strategy. We pursue the people to have the mask, face mask in the crowded and the narrow room, so to prevent the possible infectious patients. So although we did a lot of things, but we still have the risk to get the new case in domestic China. So far it's good. We are still working on it.
Very good. There was another question, just briefly, if you can answer that, on the question of immunity after recovering from the COVID-19.
Yeah. Okay.
What are your observations on that?
Yes, we do find that neutralize antibody in the recovered COVID-19 patients. So it seems that the recovery patients, COVID-19 patients, they didn't have reinfected. It's not possible to get reinfected because the neutralized antibodies work there. We didn't find reinfection so far. Although there are some redetectable RNA after discharging from the hospital, and for some rare case, they are sustained RNA positive. So for this part patients, we did a pilot study for that patients for redetectable RNA or sustained RNA positive patients. We found that in this part patients, it seems that the immune response is weak, including the memory T cells and the active T cells. The levels is lower compared with the recovery patients. So for some patients, maybe have the long-term viral shedding but most COVID-19 patients recovered well. Didn't is still working. Is a better outcome. Yes.
Thank you very much, Doctor. I really appreciate your contribution. I know it's getting late there in China, but I'm happy you are still with us. Please stay with us. Thank you. The next question is to Mrs. Helga Zepp-LaRouche from Deborah in Holland, Netherlands. She says, is it possible to bypass the political actors in the US and work directly with the institutional leadership? This could also minimize the negative aspects of the current president and amplify the productive collaboration within some US institutions and some corporations. Thank you.
I think that there are many groups in the United States who are absolutely aware that you need to have a fundamental change in the system. For example, at our recent Schiller conference, we had 6 national farm leaders who all expressed an absolute anxiety that the US farm sector is collapsing, and that they feel a complete responsibility in light of the fact that there is a food crisis and food shortage in Africa and elsewhere. So they're willing to link up with farmers around the world, but also to take a broader issue. And I think this is really, I mean, if you look at the world as a whole, you have many groups of people who are desperate. People who are day workers who just live from their salary of that day. Then others, who are losing their small business. The health workers who are not equipped with necessary materials. I could make a long, long list of people who are affected by this pandemic in a different way. If each one is only staying with their issue, as legitimate as it may be, it will not work. What is required right now is that everybody looks at the larger issue and takes responsibility for humanity as a whole. And that requires that you really start to fight for the big change. And that is fortunately, I mean, I can only advise you to watch this conference we had the last past weekend, because there you had many Americans, and this is just the beginning of it, who are absolutely willing to work with China to work on a new monetary system, a new credit system. And I think that we have to use the internet, which is now in a certain sense made it impossible to have a physical conference, but on the other side, it opens up also incredible possibilities to have this kind of dialogue and link people together all over the world. So I can only, basically ask people that you have to take the larger picture, because if you try to solve only your problem, it will absolutely not be sufficient. But we have to have a change of the entire system right now. I mean, it's not normal that people in Africa are living, or many people in Africa are living in the condition which gives, room for pandemics and starvation, and like the locust problem could have been solved 2 months ago with only 75 million euros, and it was not done. So we need a change of the system.
Thank you very much, Helga. If you want to go to the website of the Schiller Institute, in our agenda, which was sent to all the participants with the list of the speakers, there's a link to the Schiller Institute. And there you can watch the 2-day conference, which was held last weekend, which Mrs. Helga Zepp-LaRouche is referring to. Otherwise, you can ask me in a message for the address. Thank you, Helga. The next question was to Mr. Tore Vestby in Norway. The question says, would Mr. Vestby speak more about how the world could develop a reciprocation index, where nations can post more incredible examples of reciprocal diplomacy? Thank you. Is the question clear?
Maybe reciprocal. I have problems in
Yeah,
understanding.
it's like
But I guess that
yes, ömsesidig in Swedish. Ömsesidig. You do
yeah.
one thing, the other part have to do
in
something.
Swedish and ömsesidig in Norwegian. I got it.
Yeah.
You know, I believe in this win-win philosophy. If that is put as a platform, and that is actually what is the platform in the Belt and Road Initiative in itself. I believe that is a lot of good things are coming out of that. And there is also a lot of indexes in the world that are being used depending on your opinion and misused. Well, that was really a hard question for me. So I will just say that if we put the win-win thinking
Thank you.
in the bottom, and you just give away your other strategies, whatever they are, and go for the win-win, the prestige and other lockups, I believe that is a good thing. But I really think that others should give other better answers to this good question.
That's very good. Just by the way, those who have questions or those we cannot answer all their questions now, they can send us an email and we will forward it to all the speakers, because some of the speakers have already had to go to attend other work. So please write your question in an email later. We are getting to a closing point, but Mr. Shakil notified me that from Pakistan that he had one point to make.
Thank you.
Please go ahead.
Thank you, Hassan. I will be very brief because we are closing now. The first thing. So maybe we have to look at the security dynamics at the global level. We talk a lot about the terrorism. A person die with a bullet or die with the lack of the medical facility. He is losing his life. So if we call to a person who is using the bullet or the terrorist or the non-state actor terrorist, so if state is failed to provide the life security to a person and he is dying, so what we will see it? It's called state terrorism for me, because if they are not taking care of them. And second point is we have to look for some alternative economic order. So we have seen, so the inequality has been increased. We have seen the fundamental human rights have been ignored at the name of the profit, or have been made so expensive that the poor countries are unable to afford them. So what we need now? So maybe we have to move one step ahead. We have to challenge the existing economic and security orders. So maybe we have to build something on that which is more equitable and human face, not the profit face. Thank you, Hassan.
Thank you very much, Shakil. Dr. Wang, do you have some last points you want to make or any statement?
Yes, I'm here. I'm still
Please
here.
go ahead. If you have, we are closing the webinar. Please, if you have any final thoughts, we are happy to hear from you.
Oh, not a lot. I think this coronavirus is a very tricky, very tough virus. So we have to fight with the international collaboration. It's very important. The China, we control the disease well now, but we have the risk of import case. Every country have this risk if the country didn't do well. Thank you.
Thank you very much. We have a question. We will send it to you by email. It's on the origin of the virus and so on, which is still speculation. Nobody knows what the origin of the virus is, but we will send you by email this question so you can answer the person who posted. Thank you very much. I have Tura, do you want to say a final? Do you have any final thoughts?
Yeah, thank you, Hussein, for putting me on again. I would just say that I'm very thankful that you held this conference. It's very important. It really got going very well after a little trouble in the beginning. So I'm very grateful to you all on this. But I'm thinking I was taken a little bit by surprise by the question from Deborah in the Netherlands. And what she really meant is that, the aid system should be reciprocal by, like we said in Norway, we are giving to the Chinese and we are coming back from China. All these kind of things, this mentality in this is an important thing. And it also comes with a win-win thinking. That's very good. Then I have a question because of Dr. Wang's presentation is far outside my skill to understand all of it. But I know there are good people at the health authorities in Norway who are interested in having it. So my question is it possible to get that presentation and even the last presentation and all the presentations, will that be available for us?
Oh, sorry, I didn't follow your question.
Yeah, Mr. Betsby is asking if your presentation will be available to us and we can give it to people working in the healthcare system. I myself know there are a few virologists here in Sweden who could not attend. They were very interested in your work. So we can give them your email. Is that okay?
Okay, sure.
Yeah.
We can contact with each other with
Yes.
Healthcare, staff in your country. Yeah,
yes,
sure.
Very good. Thank you very
I'm
much.
happy. Okay.
Okay, I think we can give the last word, unless Isabel wants to say something. We can give the last word to Mrs. LaRouche.
Thank you very much. I will be very brief. I wanted just to say that this situation highlighted how weak the health system is around the world, not only for the least developed countries, also for the most developed countries who also struggle to handle this pandemic. So I hope that it gives a light of hope for everyone to work together like you are doing now in this conference, and that we will see it more. And I'm sure, and in Senegal, we are very positive people, and we believe that it will bring hope and what we need for people to work together and start to see it as a very important problem. That's the base. Health is the base of development. Thank you very much.
Thank you very much. Helga, do you have any final thoughts, please?
But I think that the demand that every country has the absolute right to have a top standard health system is an idea which will become more obvious as the pandemic will grow and become, more infectious in many countries. So if there is a call to have that as a standard, it can also become the leverage how to change the economic order to, make a more just system where every country can develop. Now, we will have an important step further in the mobilization for such a world health system, and that is a call of international young people from all continents on May 9th. Because I think the young people can really be the catalyzer to bring this change about. And if we carry this message in all the universities and schools and other places where young people are, I think we can have a world youth movement for a just health system and also a just new world economic order. So I want to invite all of you who feel young to be part of that call on May 9th.
Thank you very much, Helga, and all the others. We'll make sure that everybody gets the information on that, especially Isabel, you heard that. You are welcome to join the youth group. I would like to... Very happy.
Thank you for the invitation. We will be here and we will invite also our community.
Thank you.
Thank you.
Okay, now we come to the conclusion of our wonderful webinar. I think it has been very, very enriching. We had all these fantastic viewpoints from all over the world. I think this is the right spirit, how we can overcome this crisis and build a world beyond this terrible pandemic. This looks like a ray of hope in this very dark moment in the history of many nations. I thank you all for attending, and I also thank all the speakers. This has been a a very enriching and great event. Thank you very much and hope to see you again. Stay safe and take care. Bye-bye.